Analyze your actual protocols, processes, and clinical pathways in a fast and intuitive way. Every hospital has a way in which processes are designed to run. But the truth is, reality is often different. Patients, professionals, and circumstances make processes deviate from the model. These deviations are hidden in the data your systems already generate every day. How can we make sense of that data to truly understand what is happening? This is a process model. It can be drawn with different tools, and it represents the way a process should run or should be executed. And yet, processes are hardly ever executed in the way they were designed. There can be a large number of variations in the way a process has been carried out. Inverbis gives you the possibility of viewing all the different paths that have been followed in the different executions of the process, protocol, or clinical pathway. With one click, we can explore each path individually, or we can aggregate different paths. We can also view the relevant information about each path, number of executions, total and partial durations, which can be measured by the average, standard deviation, or median. And we can add data from other sources outside the EMR to provide further context and enrich the analysis. Let us look at an ambulatory surgery process. A service head wants to check compliance with the prophylactic medication administration. He immediately and visually sees that the second most executed path for ambulatory surgery does not show the administration of the prophylactic medication. Having seen this, he wants to further analyze the situation. Our filtering tool allows him to explore and analyze the data without having to know any programming language or relying on IT. He wants to know how many times this behavior has occurred and if it happens more frequently in certain services. So he applies a filter on all occurrences where the activity, medicine administration, is not present. He sees that over 30% of operations do not have the medicine administration activity registered. He wants to know how often this happens for the different services, so he creates a graph that shows this information. He can now see that heart surgery has the largest amount of cases, with 48 followed by orthopedic surgery with 28. But maybe it is because these two services have a larger amount of case. So he wants to compare the non-conformant cases with the total amount by service. We can see that heart surgery is only third in number of cases, but is first in non-conformances. The power of the filtering analysis tool is that it ready-made queries that are already defined and optimized, and that can be combined, providing millions of combinations, allowing the users to perform complex analysis of the data. For example, let's say we want to know how many cases in orthopedic surgery did not have the prophylactic medication administered, had a recovery time after the intervention longer than 2.5 hours, and happened in the first 6 months of 2022. There are just 4 cases. We can also identify loops in the executions in a few simple clicks and without requiring complex queries. Here, for example, our service head is shown different situations automatically, like when a medication has been administered both before and after the operation, or when it has been repeatedly administered. We also have a proprietary conformance algorithm that allows us to compare our models for a protocol or clinical path to what has actually happened in reality. Let's say our service head wants to check conformance with the pathway for certain ambulatory surgeries. He can select the model that represents the pathway and immediately have a view of the number of cases that follow it. He can easily explore the main deviations or non-conformances against the model. He can see, for example, that one of the main causes of non-conformance is going straight from admission to operating room without having the prophylactic medication administered. But with a simple click, he can dig deeper and understand what these non-conformances are related to. For example, he can select the service and he can see that orthopedic surgery has the most non-conformances, or that doctors 8 and 18 are worst at following the pathway. But there might be several different pathways for these surgeries. No problem, our service head can just load a different model and have his new compliance analysis automatically and instantly. You can have these models already designed using any BPM tool supporting BPMN, or you can export a specific variant or path from amongst all your executions and automatically create a model. This can then be used as a new guideline or in improvement workshops or loaded into other tools to support, for example, automation initiatives. No need to manually create models for analysis purposes. The solution can monitor processes, protocols, and pathways in real time by uploading incremental logs or integrating with your EMR. It also enables simulation of process behavior changes, prediction of outcomes, and connection to your BI tools, allowing insights from process discovery and analysis to enhance your existing KPIs. For example, in following the ICU utilization, you can have, for example, KPIs on bed occupied and available and the evolution over time of the average stay. You can see here that average stay is increasing over time. If you add KPIs derived from Inverbis that provide a process perspective, you can see, for example, if it is related to a delay in the discharge process. Here you can see that certain steps of the process take longer than expected and impact overall stay. You can even set an alert that will trigger when one such situation happens, so you can act in real time and mitigate the issue. For example, we can create an alert to trigger every time there is a delay of more than 2 hours in processing the discharge request. Every time this happens, a message will be sent to the appropriate recipient. Dynamically visualized workflows without complex queries or extra training.